Hey guys, this is Dr. Hub. Today we'll look at the DNA repair mechanisms. So in the DNA repair mechanisms, first let's look at the damaging agents. So in a group of damaging agents, we are looking at the ionizing radiation. So in terms of the ionizing radiation, then also the presence of X-rays as well as the anti-tumor drugs. So let's look at the damage which is caused. The damage which is caused, it includes the double strand breaks. There is a double strand. There is double strand breaks as well as there is single strand breaks. Then there is a intra-strand cross-links. This intra-strand cross-link as well as a inter-strand. There's inter-strand cross-links. So what is the repair mechanism here? Repair mechanism here will be NEET. So NEET is nothing but the non-homologous. It is non-homologous end joining. Next, we look at the UV light. So we look at the UV light, the presence of chemicals. So in UV light and chemicals, the damage caused will be the bulky adducts. It is going to be the bulky adducts. And what is the damage caused? The damage would be the pyrimidine dimers. And what will be the repair mechanism? The repair mechanism is going to be NER. NER stands for the nucleotide excision repair. Nucleotide excision repair. So it is NER. Then we look at the oxygen radicals. So there's oxygen radicals, there is hydrolysis as well as the alkylating agents. There's oxygen radicals, there's hydrolysis as well as presence of the alkylating agents. So what is the damage caused? Damage caused will be the basic sites. So there's going to be basic sites. There will be the single strand breaks. Then there is also going to be the 8-oxoguanine lesions. So what will be the repair mechanism in case of the oxygen radicals, hydrolysis as well as the alkylating agents? So the repair mechanism, it is going to include, there's a base excision repair. So base excision repair, we are writing it as the BER. Then comes the replication error. The replication error, there is a damage caused. Damage is nothing but there is a base mismatch as well as there is presence of the insertions and the deletions. So what is the repair mechanism? The repair mechanism is going to be the MMR, that is a mismatch repair.